Hey, I'm Dr. Brian McKay, Core Health in Darien, Plantar Fasciitis. Well, I think it's safe to say heel pain is another name for it. And basically, it occurs when the fascia, which is this thick covering of muscle tissue that bands up on the bottom of your foot, gets irritated and inflamed. And it causes a lot of pain and prevents you from doing a lot of the activities you love. That's one of the things. So, who gets plantar fasciitis? A lot of people do. One of the problems, though, is if you're heavy, if you got flat feet, you're an athlete, you run a lot, you golf a lot, you have high arches, all these things can make you have a problem with plantar fasciitis. Symptoms typically are more like, heel pain when you walk or you run, pain when you push off the ball of your foot. Also, too, is one of the typical things is when you get out of bed in the morning, you feel it. It's almost like after a night, you want to be rested and refreshed. It doesn't necessarily happen. Good chance you have plantar fasciitis. Fortunately, we have ways of helping it. Now, there's exercises. You need to do a couple exercises. I'm going to give you two of them today. Very easy to follow along with the video. I won't go into big, long explanation. Just so you're going to spread the toes out, and then you're going to bring the toes down, and you're going to lift the heel up. Very simple. Repeat it 8 to 10 times, and do it twice, 3 times a day. It's not going to hurt. If anything, it's a good stretch to kind of wake it up and stretch that fascial tissue and make you feel a little bit better. Well, here we go with different exercises that you're going to go and actually try. And 8 to 10 times, that's be enough. Follow along, can't go wrong. Very simple. There you go. Roll back, spread the toes, lean back. There you go. Good. Think you got it? Now, I want to go over something. Here is a world-class, actually Olympic athlete who has plantar fasciitis. And what's happening here is being treated using EPAT. Another name for EPAT is shock wave, pulse wave, soft wave. A lot of different names for it right now. And basically, it uses a pneumatic device to break up adhesions that form in the fascial plane. It breaks the adhesions up and it restores the normal mobility of the fascia as it rubs or glides against the other fascia. Fasciating is the covering on the muscle. It's intended to move smoothly and to facilitate smooth movement between the different muscle groups. There's a good reason we use it. It works. Shockwave therapy is one of the most beneficial things we could do, in addition to orthotics, rest, ice, and different exercises as well.
Hey,
So
I'm Dr.
here you
Brian
go.
McKay, Core Health in Darien, and you're wondering why I have this foot in my hand when I'm a chiropractor. I'm supposed to treat just the spine. Well, I want to talk to you about plantar fasciitis. Now, you may not recognize this as a foot, but it's a foot and it's a engineering marvel. When you have a good arch, as you're supposed to have underneath here, you're going to get a lot of support. There's several arches in the foot, but when you have it and they're nice and tight together, you're going to have a lot more stability in the foot. You're going to have a lot less plantar fasciitis. So typically, people are going to focus on where the pain is. And that's not a bad idea to focus on the pain, because that's what you basically pick up the phone and call me to come treat your plantar fasciitis for. But what we find is there are several muscles higher up into your lower leg on the inside aspect. And what we have is the posterior tibial, you have the extensor hallucis longus and the extensor hallucis digitorum brevis. So you have these other muscles there that all come down and connect onto your foot. So anytime you have a successful resolution of chronic plantar fasciitis, typically you're going to have to go off the side of pain in the heel. We have that tightness, that achiness when you step up in the morning, or you get from standing to sitting. But we got to work these muscles up here. Now, we use this in addition to shockwave therapy to really break up the muscle adhesions that form in those muscles that all insert onto your foot. So if you're having plantar fasciitis and you want to get over it quickly, give us a call, 203-656-3636. 203-656-3636. Thanks.
Well, if you have plantar fasciitis, you got some questions, give us a call. All right, you take care. Dr. Brian McKay, Core Health in Darien.